evening, everybody. I was asked the question if I think is Salmonella underestimated in swine farms. And I have to say, well, definitely, probably. We know so far that Salmonella infections occur in swine herds, and according to the results of regular Salmonella monitoring programs based on antibodies in fattening pigs after slaughter, there's a prevalence of over 10% in Germany. These are the actual data provided by QS. Swine farms with higher prevalences are legally forced in Germany to check on possible sources and to improve their biosecurity as well as their hygiene measures. This slide was provided by Thomas May and Katrin Spielmann from QS. This is the Organization for Quality Safety in Germany. I want to thank them for it because it shows that we've got a lot of farms still in Cat 1. Cat 1 is the best category. It means that less than 20% samples were serologically positive per year, and those samples are routinely collected from the pillar of the diaphragm after slaughter and deeply frozen. After that, the serology is performed with the standard ELISA technique from the meat juice. After thawing, a sample is judged positive with a cutoff at 40% optical density. And I can tell you at the moment there's a lot of discussion about it because the ELISA sensitivity already starts with 10% optic density. So you can see that there would be a whole lot more farms probably be affected and be in category 3. Those farms actually are fined with up to 5 cents per kilogram slaughter weight, and some slaughterhouses even refuse to take them for slaughter. So it's really not a good sign to deal with a farm in Cat 3, and lots of farms are for a couple of years not able to leave it, although they do everything to improve their hygiene and their biosecurity, and that's a bit of a problem. We know that the farms in Cat 3 are the most likely to enter Cat 3, so they have to fill up a checklist for risk analysis to prevent early the switch into another category or a poorer category. The farms in Cat 3 have to inform the local veterinary authorities, and together with their swine practitioners, they have to identify the sources for the entry of Salmonella in the farm, and they have to implement measures for Salmonella reduction. As part of the swine health service, we have a nice working group in Germany and other parts of Europe, which are working on a always updated booklet on Salmonella in swine. I'm very sorry, it's just in German, but with that link you can get to it and have a look at it if you're able to read it. There's everything in it you need to know when you want to know something about Salmonella control in pigs and want to be a good recommendation for vets and farmers. These data are from QS2, and they show you that the development from the Salmonella monitoring from 2004 to 2021 hasn't definitely changed a lot. You can see the baseline, those are the farms in Cat 3, are almost the same over almost 20 years. But you can see that there's in the Cat 2 group a doubling in 2012. So actually we can conclude that this way of monitoring wasn't highly effective for the German fattening farms. At the moment it looks much better. From 2020 to 21 there's a slow decline to see. Probably we are reaching now the times we had in 2004. There's a lot of speculation about it, but we were trying to clean farms from top to bottom after the experiences we made in the fattening farms, and probably it was possible to eradicate some salmonella from the breeders to get an unsuspicious offspring. And that was the goal during the last 5 to 6 years of work on this issue. Another point is that the German government changed the pharmaceutical law in 2014 to prevent microbial resistance in human medicine. And it was claimed that the overuse of antibiotics in farm animals was one of the most likely reasons for this. So from the second half of 2014, farmers had to report their antimicrobial use regularly to a database where they were benchmarked. But already 2 years earlier, QS started a system for the vets for reporting the antimicrobial treatments on the farms. And of course, that was the point when it started to decline. So there's possibly a connection between the reduced usage of antibiotics on the search of Salmonella antibodies, because the main reduction happened in the treatment of the nursery pigs and the fattening units. And this is something Raoul said before, that it might be an impact in the use of antibiotics on the shedding of Salmonella as well. This slide shows the development of the Salmonella positive farms for Bavaria, which is quite similar to those of whole Germany. We had a slow inbreak between 2017 and 18. But at the moment, it looks as if it's getting better. We have a gap of knowledge. We are monitoring the rear end of the pig production, and that has led us to a significant reduction of Salmonella prevalences in the fattening pigs. But we don't have any valid data on the Salmonella status of breeding, farrowing, or farrow to weaning farms. So when you're talking to a farmer of a breeding herd about its Salmonella status, then they usually say, well, what we can't see, that's not there. They don't want to know about these things because, they don't have to. They are not legally forced to do this. We are trying now for a couple of years to identify potential Salmonella-infected swine herds. We've got some data from screenings of breeding and farrow to weaning farms with blood or testicle samples, which were sent in once or twice a year for monitoring reasons. The marketing organizations in Bavaria want to testify about the health status, mostly on PRRS, but on this occasion we have the chance to look after other diseases as well. We can monitor PCV2 serology with it and Salmonella as well. We do a routine monitoring of Salmonella in the breeding farms with up to 60 blood samples per year. And we're following up on piglet producers which deliver animals to fattening farms with an unresolved Salmonella problem, farms which are already in Cat 2 or 3. When we are able to have a look in the farm which delivers the piglets, then we try to get to the bottom of the problem. We do follow-up farms as well with direct evidence of Salmonella infections by bacteriological cultures of fecal samples or by dissection material. And these are the results from the monitoring of the piglet producing farms in Bavaria via the serology of the testicular fluids. You can see we had a strong decline of farms from 2016 to 2020. We started with more than 100 farms in Landshut and now with 31 farms. But when you look at that, then you can see the farms are declining, but the Salmonella positive samples are rising. So that it's not a fact that makes us really happy at the moment. When we looked at a routine serology of blood samples, then it was apparent there was a problem in 2018 in Bavaria, and that can be explained by an entry Salmonella agona in soy with the feed in a lot of farms in southern Germany. After this, the results were much better, but you can't prevent those events happening. This slide shows our microbiological investigations on Salmonella during the routine diagnostic, and we made a switch from the fecal samples to more swabbing of the environment and the floors, which gives us much more positive results finally, and this is really nice matching to that what Raoul said before. We've got a detection rate of Salmonella during our post-mortal investigations between 2015 and 2019 around 0.6%. And compared to the detection rate of Salmonella in varying materials from our food safety agency in Bavaria, you can see that there was an increase over the last few years as well. So yeah, it's really surprising what has happened in the course of 10 years with Salmonella in farms. Our necropsies showed that from 30 animals, 25 submissions were tested positive for various Salmonella serotypes, and it was quite astonishing that the clinical signs varied. The most common Salmonella we found during the necropsy was Salmonella typhimurium, and we had a really colorful bunch of clinical signs, from diphtheroid necrotizing enteritis, from necrotizing colitis to necrotizing enterocolitis, hemorrhagic enteritis, catarrhalic enteritis, but sepsis as well. And finally, there were 4 animals which are just lucky to find because they hadn't shown any special symptoms, but were tested positive for Salmonella typhimurium finally. Other Salmonellas were apparent as well. Interesting too is the Salmonella group C, which contains the species-specific Salmonella choleraeus, and close to septicemia, there were also findings of pneumonia, and nobody having problems with coughing piglets in a nursery would think of an infection with Salmonella. So it's really nice to see how many different diagnoses were made before this. When you look over the years, it's an increase in the positive findings of Salmonella in the necropsies, and what is really nice to see as well, Raoul has shown it already, that the suckling piglets are definitely a source of Salmonella. The most findings we had during the necropsy was in suckling piglets. There's another search in the end of weaning period, but finally the heavier animals were not so often delivered in our pathology because we've got a weight limitation to 60 kilogram for pickup service, and this might explain that we don't find so many in the older piglets. We don't get so many older pigs. That's the problem. And as already shown, Salmonella typhimurium is the most common Salmonella serotype we've got to deal with. Salmonella has different phases, and especially the species-specific Salmonella serotypes are responsible for very severe clinical signs like fever, septicemia, diarrhea, high morbidity, and mortality. And the species-specific Salmonella serotypes are mostly Salmonella choleraesus or Salmonella diffusus. And if you look at oh, pardon, I got to go back, sorry. If you look at those pictures, then heavy hemorrhagic diarrhea, blue ears, signs of septicemia, running around. Those signs, when they happen in an acute phase on a farm, they require veterinary support. And if you go to such a farm, you won't miss them. But don't forget to exclude other diseases like swine fever, which could appear with similar symptoms. The non-specific Salmonella serotypes like Salmonella typhimurium or Salmonella enteritidis, Salmonella derby, show more mild clinical signs and can be totally asymptomatic. Mainly it's diarrhea you can find, and more the younger pigs like weaners are affected. We are offering a project for the piglet producing farms in Bavaria with a suspicious Salmonella background. They get free and unlimited access to sampling of blood, feces, feed, water, floor, and iron mantle swabs to examine the distribution in Salmonella across the whole production line. We had in the last 5 years 24 farms that took the chance. 20 farms started with hygiene improvement, better biosecurity, and feed additives like formic acid. 4 farms also implemented vaccination against Salmonella, and up to date there are 18 farms now unsuspicious at the moment, and including 3 of them still vaccinating against Salmonella. And one of my colleagues, thanks to Lothar Richter, provided me with a clinical case. It is a closed herd of 3 unproductive sows in northern Bavaria with a 4-week farrowing interval. The weaners were kept in a special compartment for 3 weeks until taken to the nursery for further breeding because they have just a 3-week suckling period and need special foster care. In 2017, they had high losses of suckling piglets and severe diarrhea during the first week of life and in the after weaning period. And they started with an autogenous vaccine for the sows with E. coli and Clostridium, etc., and zinc additive in the feed after the weaning. They weren't quite happy with the quality of the feed. They suspected a little bit of mycotoxins, so they worked a little bit on that too. But in the swabbing, they had fecal swabs positive for Salmonella enteritidis in the suckling piglets and in the nursery. They had fecal samples in the nursery positive also for Lawsonia intracellularis. The blood samples collected in the nursery and the fattening unit were highly positive for PRRS. And the runs from the nursery who went into necropsy were also positive for Salmonella enteritidis. There was a huge problem with rodents and flies on the whole farm ground, and that was another point where they had to work on their hygiene. After the higher hygiene measures hadn't improved the situation significantly, they decided to vaccinate against the Salmonella enteritidis, and they did it with an inactivated autogenous vaccine. It was combined with a common and autogenous vaccine against E. coli and Clostridia, and both types were given 6 and 3 weeks before farrowing. On the other hand, the piglets were administered vaccines against ileitis and PRRS during the suckling period. The results of the first swabbing showed that there was a huge Salmonella enteritidis problem in the nursery as well as in the fattening unit. The socks were positive and parts of the environmental swabs were also positive. After months, still high Salmonella titers in the fattening unit sustained, and the diarrhea in the nursery sustained as well. There were less runs, but still 3 to 5% were with a retarded growth despite the high levels of formic acid, which was given in all stages. The compartment for early fostering with a special pipe feeding system for the young piglets was modified to a normal nursery unit because it was found that there was a really good spreading for Salmonella enteritidis. The decision to vaccinate the piglets 2 times orally with Salmopork was then to block the early infection with Salmonella and to build up an unspecific gut immunity. They applied the first vaccination in the first week of life and the second after weaning in an antibiotic-free window. And then the magic happened. The clinical signs vanished already with the first group of vaccinated weaners in the nursery. These are the swabbing results of mid of September, almost 9 months after the first one. And it can be shown that the clinical cases or the clinical findings of the field strains of Salmonella enteritidis were less. In the compartment with a removed pipe feeder could be found a vaccine strain, but still Salmonella enteritidis. And there was a swab taken from liquid residues under the doors after cleaning, which also still contains Salmonella enteritidis. But the rest of the swabbings were really looking much better now. In the third investigation, it looks definitely best with just the vaccine strain in the sock swabs in some of the nursery areas. That investigation focused a bit more on the watering system because they had found out that there must be some kind of reinfection with Salmonella because of the antibody titers still high at the end of fattening. And it was a success in one of the fattening units. They found Salmonella enteritidis also in the water pipe, and then they installed water disinfectant system with chlor dioxide and cleaned permanently the water pipes. So this is probably a story of success because the clinical symptoms were gone and the hygiene was much better. Not everything was at its best, but the farmer had reached a goal which was okay for him and for his piglets as well. I can conclude now that it's not clever to underestimate the impact of non-specific Salmonella infections in swine because especially the Salmonella typhimurium is very common in the vulnerable parts of the pig production, and it comes with surprisingly different phases. Pneumonia, septicemia, and diarrhea are very often treated in the weaning units with use of antibiotics, and I know many people who try to treat them with an antibiogram. Usually you just start with your antibiotics and you miss it if you're not really looking for it.